The Valley's 65 and older population is expected to nearly double in size by the end of this decade. How local governments can best serve that growing population is the focus of the Municipal Aging Services Project conducted by MAG, the Maricopa Association of Governments. Here with more about the project is Amy St. Peter, MAG's Human Services Manager, Carol Kratz of the Virginia G. Piper Charitable Trust, and by the way, they are supporting the project, and Michelle Dionisio, President and CEO of Benevilla, an organization that provides services to Arizona's senior population. It is good to have you all here. Thank you so much for joining us. Amy, I'll start with you and the Municipal Aging Services Project. What exactly are we talking about here?
We're talking about trying to determine the best and most effective role for local government in meeting the needs of their residents age 65 and plus, really in collaboration with a number of different stakeholders. So there are a lot of really good people doing some really good work in this area, but given the increases in the population, the impact of the funding reductions and the recession, we need to do more with less, and we need to figure out the best way to make that happen.
Carol, surveys, focus groups, these kinds of things involved here?
Yes, absolutely. The project was very, very well done in terms of individual interviews, in terms of focus groups, a lot of demographic analysis, so it really provides a wonderful foundation for what do we need to think about for this doubling of the population by 2020. It's not the same population as Grandma and her retirement, and so I think this really provides a very good framework for local governments and the rest of the community to think about how we need to change what we're doing.
With what you're doing, this kind of information, this kind of framework, how does it help?
Well, actually, in engaging the cities more and providing resources that will help nonprofits be able to reach out to the community and do the work that's needed to meet the needs of the aging population. But, you know, again, it's a different population than what we've traditionally seen.
Talk more about that. How does it differ?
Well, you know, we're finding a lot of younger boomers coming and wanting to do meaningful work, more than just passing out, you know, drinks at the hospital. They really want to get involved in some planning. We have one volunteer who actually organized our bookstore for the nonprofit. We have a little bistro. She plans all the musicians coming in and doing jazz jams and all kinds of activities. So really trying to tune into each individual's skills and talents and being able to put it to work for the community. We have master gardeners who are helping with a community garden. So really finding meaningful ways to engage people.
How do you find meaningful ways to engage people, though, when the population is going to explode the way? Is there enough? Are there enough gardens? Is there enough to do?
There's definitely a lot to do. There's enough to do. The problem is that we aren't always lining people up with those opportunities. For example, in our survey, we surveyed over 1,000 people in Maricopa County, age 55 and older, and we asked them about their ability to interact with their peers and to be engaged in the community. And nearly 75% of them had no idea about what was going on at the public level or really with the nonprofits. They never accessed those kinds of facilities. 43% said that they just weren't aware of them, and a number of them just didn't have time. They're busy doing other things. They're going back to work when they thought that they would stay in retirement. So we really need to carefully look at the population and really start planning right now, because there are a lot of significant changes ahead.
What kind of planning can local governments do, though, especially when you're talking about a group? I see being active is important, employment, health, connecting with others, transportation. People don't even know that stuff is out there half the time, as we just heard. How do local governments respond to this?
Well, I want to back up to your prior question, because there is an organization that is in place now called Experience Matters, that is really a focal point for connecting older adults who want to give back to the community with nonprofits who are trained in how to use them, and then matches are made. There's a new program called Encore Fellows that provides a stipend of up to $20,000 for these really skilled individuals who are retired to contribute back to the nonprofit. So I wanted to make sure that folks know about that. Local governments, it was fascinating at the MAG meeting on Wednesday. There were a combination of local governments, universities, nonprofits, funders, everybody coming together to say, we understand that this is a different day and we need to work together. So I don't think it's just local governments, but local governments now have a growing number of older adults. Scottsdale's the #1 city in the country with the highest percentage of older adults, 65 plus, and Surprise is number 4. So, I mean, it's not an issue for tomorrow, it's here now.
I hear Scottsdale, I hear Surprise, and I also see that things like affordable housing, in-home care, those are important responses as far as these surveys and focus groups were concerned. How does that dynamic work?
And that's where volunteers really come in and help. We have 650 volunteers at Benevilla, primarily older adults, providing that service to their neighbors and friends in the community. So I envision in the future we're going to see more of that. We're going to see more families volunteering. We look at this as a community for all ages, and that everybody's getting involved to support one another, share the assets we have.
You mentioned that so many folks don't really know what's out there. How can local governments do a better job of letting people know what's out there?
That's a great question. It's one of the questions that we asked through our survey as well. People want to hear from email. They want to be able to access things on websites, and they aren't always wanting to come to the public hearings. It's very natural to have a public hearing and then no one attends, or it has very limited attendance. And people want us to go to them and to really make that as accessible as possible, and that includes going online. And it's not something that we're always doing enough, but in some places we're doing more of, and it's had a great impact.
Does that make sense to you?
Absolutely. It goes back to the mindset. Older adults aren't people who retire on Friday and go to a nursing home on Monday, as I think some of our mindset has them do. They're people who are vibrant, who are active, who are engaged, and who access information by email, and we're going to see more and more of that.
And I think if I could just add to that, I'm seeing more and more homebound people really relying on their computers to be able to access services and information.
And again, that's what we talked about earlier with at-home care, affordable housing and such. It's a lot of folks want to stay where they are. Is this more so? Are you seeing more of this now?
Absolutely, absolutely. In our community, there were early founders 30 years ago that put our organization together. They really saw the vision, and they said people don't want to move to another institution or whatever. They want to stay in their own home. So we have handymen that install grab bars. We have people who take people to the beauty shop or to the doctor's appointments and different things like that. So really enabling people to stay in their home.
Please.
And to build on that point, we conducted 135 interviews with really key leaders throughout the region. And then we went out and we conducted 19 focus groups with more than 200 people, most of whom were over the age of 65. And resoundingly, they all said, we want to age in place. The problem is we don't always design our communities to allow people that option. So if they don't have a variety of housing options within their neighborhood, that means that they have to move, and then they have to build up new support systems somewhere else, and often that's extremely difficult.
How would you design communities to provide more options along those lines?
It's important to really look at housing, transportation, and employment. In terms of housing, we need to have a range of housing options so that if people want to downsize after their children move out, then they can do that and stay in their neighborhood. Also, transportation. We need to make sure that people can move easily throughout the region so they can get to the medical appointments, to their jobs, to education. When we surveyed people, 11% said that they use transit right now. That nearly triples to 30% in the next 10 years. They said in 10 years we won't be driving as much. The number goes from 90% now to 67% in 10 years, according to their projections. And that's really shifting to transit and to getting rides with family and friends. So we need to make sure that people have access to those.
Last question, last word. What do you want people to take from this survey? What do we need to know? What do governments, what do services, what does everyone need to know about an aging population?
Well, the time is now to look at how this population has changed and is changing. It's going to be a totally different group of folks by 2020, and to not come together now and recognize these changes and look at our institutions, look at our cities, our towns, our nonprofits, and figure out how do we make this even better. And I think we have the opportunity to do that with Meg's study.
All right, very good. Great conversation. Good to have you all here. Thanks for joining us.
Thank you so much.
And Wednesday on Arizona Horizon, an update on plans to expand the Metro Light Rail further into Mesa. And just in time for spring training, an ASU professor explains the science of baseball. That's Wednesday on Arizona Horizon, 5:30 and 10, right here on 8 HD. That is it for now. I'm Ted Simons. Thank you so much for joining us. You have a great evening.